If you found out that mammograms were less likely to catch breast cancer in you, your next question would probably be, what can I do about it? It's something more of us will be asking after a new state law takes effect next month. The law will require providers to notify women whose mammograms show that they have dense breast tissue, because that tissue can make it harder for mammograms to find cancer. Dr. Jessica Keto is a breast surgeon at Mercy Health in Grand Rapids here. Thank you so much for joining us.
Thanks for having me.
Appreciate you being here. So if I open up this results letter and
Sure.
it says to me I have dense breast tissue, I want to know what test then would most likely be the one to help me? It's the MRI, am I right?
Not necessarily.
Okay.
So what the law states is that women should be notified if they have dense breast tissue, and dense breast tissue, breast density is categorized by 4 levels, A, B, C, and D. C and D being the 2 highest levels, so all women with C and D levels will be notified. However, what's important to notice is that only women with level D breast density may increase the risk of breast cancer. So when we talk about mammograms and effectiveness in density, density does decrease the efficacy to a small degree. However, mammograms are still very important. In women with breast density, you're right, the next question is, well, what else should we do? There are a lot of different options. 3D mammograms are a very common tool that are used, and then MRIs are also a tool that are used, specifically in women who are felt to have a lot of other risk factors for breast cancer.
But the MRI is the one that sees the breast the clearest. Am I right? Especially, I know that's being suggested for women at highest risk, so that
Correct.
must be the clearest picture.
Yes and no. So there are, every time we look at a screening tool, we look at appropriate uses of it, so the goods and the bads, and reasons to use it on specific women. MRIs are very good at finding early breast cancers, and we use them in women who we identify as very high risk. Correct.
Mm-hmm. Yeah. So while supporters of this new law want women to have as much information as they can, the medical community has sort of pushed back on this a little bit. Why is that?
Well, I think the concern from the medical community is that what to do with breast density is not something that's clearly defined at this point for providers in the medical community. So I think the concern for a lot of providers was, we don't want to give information to women that may be potentially scary, but then not have the answers of what to do next, as well as not having the resources to do those with. So what's important to know is that while you'll be notified of breast density, that's not necessarily something that is mandated by insurance to cover additional imaging. So that's why really combining the whole picture for a woman is really important. So knowing what imaging she needs, knowing that you should always be doing a breast exam, both by yourself as well as a provider, knowing what your risk is. So do you have other risk factors beyond your breast density that would make you a very good candidate for additional imaging? So that's something that we try to do at our Mercy Health Breast Center, where we're able to combine imaging with a risk assessment and really dial down on what the best imaging with the lowest impact for potential negatives, as well as the best options for finding a very early breast cancer are.
Okay, so we've got tomosynthesis, MRI, there's ultrasound, there's next steps that people can take. And once they find out if they're in the category where they do need to take a next step, it's talk to your doctor.
That's really the bottom line, because while screening imaging is very important, in my mind, even the step beyond that is, what can we do to reduce a woman's risk? Screening doesn't reduce the risk, so we want to combine very good screening with also efforts to reduce a woman's risk when we identify that she's at higher risk.
Okay, Dr. Keto, thank you so much for joining us tonight. We
Sure,
appreciate
thanks for
it.
having me.
Our coverage continues on 24-Hour News 8, 8 West, woodtv.com, WOTV for women. If you want to check more resources and personal stories right now, you can find them under the 8 West tab at woodtv.com.